Welcome to another episode of The Midpoint. Today, I'm so pleased to introduce our next guest, who is joining us from across the globe in Taiwan, Dr. Shao-Hsuan, the Director of the Division of Pediatric Respiratory Therapy and the Chief of the Pediatric Intensive Care Unit at Chang Gung Memorial Hospital in Taipei. He's got years of medical and administrative experience and has witnessed Taiwan's coronavirus response from the front lines. Thank you so much for being with us today, Dr. Xia.
Thank you. Thank you too.
Wonderful. Why don't you talk to us a little bit about what the current situation in Taiwan is? Are things open? Are businesses, schools, are they running?
Yes, I think the answer is yes or no. We are open. People go to their work as usual. Students go to school, and people will go to some tourist sites in holidays. I think it's open, but however, few people can go to other countries. Fewer people go to some popular indoor places, such as movie theaters, department stores, and the malls. And people need to wear masks and take temperatures before entering their work. So, and the government asks people not to hold meetings or parties of more than 100 people. For us, medical students, they cannot enter the hospital. So all the classes related to clinical, we have to use online internet video to teach or to learn. So partially it's not open. Yeah.
So you mentioned how some schools are responding, that some things are closed, but I know that, for example, elementary schools or even middle schools and high schools are still running. I mean, as you probably know, in the United States, everything is shut down. You know, how are those places staying open? What kinds of protocol are they using to keep things functioning during this time?
Okay, first of all, students just come back from other countries is asked to keep at home for 14 days, and after the 14 days, they can go to the school. And if there is, they need to wear masks before entering the school, and teachers will take temperatures in the door of the school to check if anyone has fever. And the school, they don't allow the air conditioning. All the windows need to be open. And yes, if anyone students have fever, the whole class will be shut down. If 2 students in the school has fever or suspected case, the whole school will be shut down. But fortunately, no, it hasn't happened.
Yeah, and you mentioned that it really hasn't gotten to that point yet. I mean, Taiwan's numbers right now for COVID-19 are remarkably low. At the last count that I saw, there had only been 7 deaths, and there were under 500 cases since the beginning of the outbreak, which is just incredible. I mean, how did the government administration respond so swiftly, and what has that leadership looked like so far?
Yeah, first of all, we have a very bad experience in the 2003 SARS pandemics. So actually, both the government and the people learn from it, and people are more willing to follow the policies of government. And the government has collected many experts to organize a team to manage these things. Yeah. The government, first of all, they control all the materials for medical use. They prohibit the mask export and also the PPEs. So this can assure that the hospital staffs will have sufficient PPEs. And then first Wuhan, then the whole China. We prohibited people from China and other countries with this disease to come back to Taiwan. Some, only few of them can come back, and they need to be quarantined and stay at home at least 14 days to be assured that they don't have the disease. Yes, and the government will ask people for not to go to crowded places and wearing masks and wash hands with and disinfected with alcohol, such things. Yeah, I think people are has the bad experience in 2003 SARS, so we are very willing to follow the rules.
Yeah, and I think that's something that here in the U.S., we weren't hit as hard back in 2003 with SARS. We weren't hit as hard with MERS. We haven't had this kind of experience of extreme pandemic. And in some ways, that's really been, a loss for the U.S. because we maybe weren't as prepared or have had the experience to know how to deal with it. And U.S. citizens are so new to this kind of experience, but it's pretty incredible to see how swift Taiwan has been in tackling it. And, one other thing that's really interesting is I know that, especially, for example, Taipei is such a huge city that's cramped in close quarters. A ton of people ride the subway, use public transit. It's very much an urban city with a high volume of people that are close together. How has, the population managed there in terms of public health and safety, whether that's increased signage or how they're dealing with public transit or any of those things?
For the public transport, I think in the beginning, only few people will use the MRT, the subway. So if you can see my pictures, then in the rush hour in the morning, only few people in the car. And I think they just switch to riding bicycles, riding motorcycles, or drive themselves to go to work. And the other things, many social activities are canceled. For example, the Congress of Pediatrics, we in April, it was scheduled in April. We just canceled it. Yeah. So the people are not, there are no so many people using the public transport. Yeah, and people are asked to wear masks before entering the MRT, and we have alcohols in the entrance. We can use it to disinfect our hands. Yeah, and some buses, long trip buses, they just have a transparent curtain in every single seat to keep the safety of the travelers. Yeah.
Yeah, that's pretty incredible. And I'm sure you've heard about the protests in the US. A lot of people maybe not willing to follow some of the restrictions or still attending a lot of social activities, not wanting to wear masks, not following social distancing. Do you see any of that in Taiwan? I mean, how do Taiwanese people see these kind of restrictions? I know you mentioned SARS, so of course there's been experience before, but are you seeing anyone who's not willing to follow those guidelines?
Yes, it is reported that some people are argued not to wear masks and quarreled with the officers. But almost 95%, more than 95% people is willing to wear masks. Yeah. In my experience, when I go to the international airport to do quarantine there, there is a young man who was taken to the station, quarantine station, and he looks very healthy. So I asked him why, what's wrong with him. He said he had only mild cough and diarrhea for several days. So he declared, and the staff brought him to the station. I mean, if he didn't say, nobody will know he had such symptoms because it's very mild. But I think he knew that this is to protect himself and to protect others. So he is willing to declare that he has such mild symptoms.
Yeah, and that's maybe really what it's about is, thinking about what overall the good of public health, those others around us. I know that even wearing a mask, right? It's not just for protecting yourself, but actually mainly for protecting those people around you in the case that you may be carrying, because it's really scary, that this virus, you may not even know that you have it, that you may be asymptomatic, you may not have severe symptoms, but it absolutely could affect those around you. And I mean, I'd like to pivot maybe to some of your experience. Maybe you could talk about your background a little bit. I know that you work in a main huge hospital and that you have experience both in pediatrics, but in administration as well, and dealing with hospital policy and management. Could you talk a little bit about your own background?
Yes, I'm a pediatrician, a pediatric intensivist. I work in a Pediatric Intensive Care Unit, which has 26 beds. Most of the patients are from 1 month old to 18 years old. They have very critical disease such as respiratory failure or shock or other critical disease. Yeah, this is my background. Yeah.
And how have you seen hospital protocol change, or what kind of measures are being implemented in the hospitals as we're facing the spread of COVID-19?
Yes. First of all, the hospital, previously we have about 10 entrances, and most of them are shut down. We have only 2 or 3 entrances now. And people entering the hospital, no matter he is a patient or visitors, they have to be quarantined. They have to be taken temperatures and asked the history of so-called TOCC, travel, occupation, contact, and clusters. Yeah. If he has fever or other suspected symptoms, he is asked to go to the quarantine station outside the ER. Is outdoor quarantine station. So there are staffs to to do tests for the patients. If the patient is suspected to be COVID-19 patients, he will be, if he needs admission to hospital, he will be located in a special area called a yellow area. If the patient is confirmed to be COVID-19 or he has pneumonia of unknown origin, he will be kept in the red area ward. So all the area of yellow or red, the medical staff will be fully equipped with PPEs from head to toe to take care of them. Yeah. And we have special protocols for patients with respiratory symptoms. We stopped so-called nebulization therapy for them because the aerosols may have possibility to bring the virus to spread. So we stopped the nebulization therapy, and we decreased to use so-called non-invasive ventilators. And we minimized the work of suction sputums. And we have special protocol for intubation protocol for the respiratory failure patients. We use so-called video laryngoscope to intubate these patients, to keep away the mouth and noses from the doctors. And we, every case of intubation, we ask the anesthesiologist to back up. They have endoscopy. If the intubation is fails, they will come in at once to do the endoscopic intubation. Yeah, this is very different.
Yeah, it seems like there's just a huge amount of care and caution, especially on the end of the healthcare workers. You know, here in the U.S., especially recently, there's been a lot of conversation around how much our healthcare workers are putting their lives at risk. You know, and it is an incredible sacrifice, not just here, but everywhere. But one thing that we're facing here in the U.S., and you mentioned PPE, but, we have shortages of masks, of gloves. I mean, our healthcare workers, our doctors, nurses, other workers are reusing their masks and their PPE. They're going in there every day and putting their lives at risk. There are also shortages of other medical supplies or respirators, or even shortages of staff members themselves. Are you seeing that in Taiwan at all, or are you still functioning pretty normally?
I think we function very normally. First of all, almost all the hospitals canceled the routine surgery in every hospitals. So there are more manpowers, there are more ventilators, we have more PPEs to use in other fields. And the government will provide all the medical staffs one mask per day, surgical mask, yes. And we have sufficient PPEs to use in the hospital.
Obviously, Taiwan has been now a kind of, in some ways, a global leader in its response to the pandemic. This small island country that so many people may not have even heard about suddenly has kind of skyrocketed to be a leader, globally. I mean, how How are Taiwanese people responding to that? And, what do you think that means for Taiwan's participation in, global conversations? Of course, there's been conversation about the WHO, and leadership and Taiwan's role moving forward. Do you have any thoughts on that?
Mm-hmm. Yes, I think we are proud of it. We are proud of that. We have doing very well in the coping with the disease, and we also think that we should have an opportunity to share our experience in what we have been doing for this disease, and we can share our experience to other countries. We are very willing to share, and I think we also should have the chance to be a member of the WHO and to get some important information from it, not from other countries. So I think that we have 23 million people here, right? We shouldn't be an orphan or something. We should have I think we should have the right to be a member of it.
Yeah, and I think there's so much that we can learn, specifically I think in the U.S. as well, both from the administration and how the government's handled the crisis, but also how the population has responded. How citizens have kind of banded together to protect the public health, to protect one another, to be willing to maybe be limited for a little while for the sake, of that brighter future. I do have, maybe one last question on that, which is, if you had advice for, maybe some Americans facing this crisis today, or our population, as you know, the U.S. is now the epicenter of the crisis. We're facing, thousands of deaths, and now just reached, we're now over 1 million cases. So, we're seeing really a deep crisis here, and a lot of division, a lot of different opinions. What kind of advice would you want to give to Americans looking at this crisis today?
I want to tell all the U.S. people that it is not a disease that cannot be prevented. Yeah, look at us. We in Taiwan, we can do it, so you can do it too. Just wear masks, wash hands, and declare any trouble such as fever or respiratory symptoms. Just do these things to protect yourselves and other people.
That's great advice.
You can do it.
That's great advice. Thank you, Dr. Hsia. And I want to thank you again for sitting down with us today. It's really, a privilege to hear your experiences, what you've gone through, and, your observations on the world situation. So thank you so much.
Thank you. Thank you.
Thank you all again for watching this week's episode of The Midpoint. It was great to hear from Dr. Hsia about Taiwan's response to COVID-19 and how they've kept their numbers so astonishingly low. We have so much to learn from these experiences, and it's certainly humbling during life and death situations such as COVID-19. If you enjoyed this episode, like, comment, and share, and please consider subscribing to our weekly email newsletter, and the link is in the description below. As always, stay safe, stay healthy, and stay human.